I'll look for an adapter so I can just come.
We're missing the beginning.
Okay. Pharmaceutical and medical device companies in the global health realm. I want to begin by briefly recapping the key ideas in the report. Next slide, please. As a start, it's important to say that pharmaceutical and medical device companies unquestionably create shared value, as they have contributed to great improvements in health and well-being. But the shared value has been concentrated in established markets of North America, Europe, and Japan. As you can see on this slide, pharmaceutical sales are dramatically out of whack with the burden of disease in the world. North America and Europe make up 3/4 of the pharmaceutical sales, but represent less than 1/3 of the percentage of deaths due to treatable illness. This picture is nearly identical for medical device companies. Next slide, please. By and large, companies have responded to this imbalance with corporate social responsibility and philanthropy programs. Starting with Merck's Mectizam program in the 1980s, we've seen amazing innovation in product donation, capacity building, and R&D partnerships. It's important to note that these programs serve very important patient groups in remote places of the planet, and millions of lives have been saved. But as many companies have learned, the resources available for CSR and philanthropy pale in comparison to the problem. Around the world, 7 billion people lack access to essential medicines, in many cases drugs that could save their lives. Next slide, please. For quite some time, companies have held the assumption that patients in low and middle income countries represent little or no commercial interest. But the basis for that assumption is changing for 2 reasons. First, margins are under pressure in high-income countries. That's a different story. Second, as you can see on this slide, low and middle-income countries will be the fastest-growing markets for pharmaceutical and medical devices over the next several years. Next slide, please. As you'll hear today, and as you can read in the report, these startling projections could become even more significant through concerted shared value approaches. Companies, the ones featured in this webinar today, are systematically and relentlessly uncovering new unmet health needs, finding new ways to address them at scale. Our report shows examples of how companies are beginning to compete on the basis of improving health outcomes for the underserved through 3 mutually reinforcing levels. First, companies are developing new products, adapting existing ones, or changing their offerings to meet conditions. GE's MAC line of electrocardiogram systems, which are battery-powered, sold at a fraction of their cost in European and US, is a great example of reconceiving products and markets. Second, companies are changing the way they manage their value chains through more localized R&D, more efficient manufacturing, and innovative distribution. Lastly, companies seem to roll up their sleeves and strengthening the enabling environment in which they operate through investments in health systems, for example. Novartis's Aroiga Parivar program has built the capacity of partners throughout India, such that the company is serving 42 million people in 30 villages across 10 Indian states. Next slide, please. And so we get to implementation, the focus. So how are companies and partners getting the job done? Our research uncovered 5 common success factors among companies as they implement shared value. First, companies that accept shared value have CEOs and country-level managers who bring a compelling vision and personal involvement to expansion efforts in low and middle-income markets. I'm sure that Duncan Learmouth will tell us about the important role GSK's CEO championing shared value at that company. Second, Among companies that are pushing shared value boundaries, we've noted a culture of innovation and learning reflected in structures and in. For example, companies like Medtronic and Novartis have specialized global health innovation units that coordinate shared value efforts across their companies. The third implementation principle is perhaps elusive. Among a few companies, notably Novo Nordisk and GE, these approaches to measurement that track the link between business value and improved patient lives. Such metrics offer companies a way to understand and create shared value and allows them to assess the potential of new investments, to allocate resources, and to set relevant incentives. Fourth, we heard about a diversity of new skills acting on unmet health needs. At Becton Dickinson, for example, the company's senior leadership redefined the country's director's role, emphasized knowledge of health needs, and strategic planning based on addressing those gaps. Lastly, new partnerships forming for shared value insights and implementation. Pharmaceutical and medical device companies have long partnered with NGOs, donors, and global bodies such as WHO and Gavi. But companies are looking to a new set of partners to help with shared value strategy setting and specific competencies, adapting products, improving productivity and cost effectiveness, and strengthening the competitive context. Many of these partners are nonprofits, which marks a shift from prior corporate philanthropic grantees. We'll hear about these 5 implementation goals during our discussion today. This is a great segue, as our panelists will share stories about shared value implementation. Let's first turn to Duncan Learmouth from GSK. Next slide, please.
Hello, everybody. Thanks, Kyle, and good morning, good afternoon, wherever you are listening in. At GSK, over the last few years, we've taken a much more ambitious approach to access to medicines, and as Kyle said, under a new CEO, Andrew Witty, that's been a big factor towards that approach. In August 2010, we formed a new unit, the Developing Countries and Market Access Unit, which I lead, which focuses on the needs of least countries. The reason we did that is for reasons of the situation in those countries, as you can see on the left-hand side of the slide. The urgent challenge that exists with around about 800 million people in 50 countries, 40 countries in Africa, and 10 in Asia. And those people obviously represent some of the poorest people in the world, and 50% of that population group lives on $1 a day. Another important dynamic that exists here is the lack of capacity in these countries to address the healthcare challenge. And if we take Africa as an example, the continent has to cope with 24% of the world's disease with only 3% of the world's global healthcare and only 1% of global healthcare budget. So what we felt at GSK is that special circumstances around least developed countries really demand a different solution. And what we were looking to do to combine that access challenge with this engine. So how can we actually link those two things together to create a sustainable approach that results in shared value both for our business and for patients? And the business opportunity is clearly there and is clearly important. And you see on the slide on the third bullet under situation, often these countries are growing fast economically, some of the fastest growing economies in the world, albeit very low base. And where we see that happening, we tend to see healthcare spending rising at a faster rate than economic growth. So actually there is an opportunity in the healthcare space. I also felt that plan for success. So least developed countries won't all be least developed countries forever. And actually now it's time to invest, to build footprint, build market share. And we feel that early movers like GSK, we hope, are able to build that footprint and build brand recognition advantage. We decided to form a new unit to call this Bench and Opportunity. And the new unit is 50% focused on access and corporate responsibility, 50% focused on building our business for the longer term. Those goals come together, if you like, through the strategy to support building our footprint for the future and building the volume of medicines we supply, which improves access to patients over the long term. And our goal is to increase the volume of medicines that we supply in the countries from around about 6 units of medicine last year in 2011, and to increase that 5-fold over the next 5 years. If you move to the next slide, you can see that what we are pursuing and how we are meeting that goal demands actually a new way of doing business. And the unit itself sits obviously within GSK and sits within our business, reporting into our markets business. But it has essentially what I call new rules, ways of doing business. So on the left-hand side of you can see we have rules around affordable products. We've capped our pricing for our patented medicines and vaccines to no higher than 25% of the UK price. We're also, and Carl referred to this in his introduction, to making our products more appropriate for least developed countries, where you have acquisition cost of medicines is critical, and you have patients who are usually on incomes, and therefore you have to get the price point right down to that level. And we have lots of examples of products that we're developing which get into those smaller pack sizes and lower acquisition costs. Secondly, we have realigned within the unit. So our employees are focused around volume, and that's our incentive structure is all about volume, it's not about revenue. And we also have a longer term investment horizon. Rather than what you might see as a standard return on investment of 1 to 2 years, we are happy with a longer term investment horizon of 4 to 5 years, providing that builds footprint and capacity for the future. Thirdly, infrastructure investment. We recognize the huge capacity challenges in least developed countries, and that's why we've committed to reinvesting 20% of any of the profit we make in each country that we operate back into healthcare infrastructure in that country. And we have some significant programs in partnership with NGOs around training healthcare workers across all the markets where we operate. Finally, there's a summary in that slide of the new structure, and just repeating that the dual focus here, which is corporate responsibility, but linking it with long-term growth for the business. And you can see, so on the slide, we have 40 employees in the unit, so it's not a huge business in GSK terms, but it is significant, and we have employees in nearly every country of the 50 that we operate in. And to orientate you in terms of the size of the business, it's about a $200 million business. You go to the next slide. I wanted to give you just a quick overview of our strategy. So how are we actually going to make that 5-fold increase in volume? We're actually going to focus, or are focused on 4 areas. Firstly, vaccines. We have an innovative vaccine portfolio which is particularly for a developing country setting. So our approach is to support our vaccines for diarrhea, pneumonia, cervical cancer, and we hope by 2015 a new vaccine for malaria. And we think that our vaccines portfolio will support probably half that fivefold in volume that I talked about. Secondly, we want to expand our portfolio through registering many more medicines in least developed countries. At the moment, we have a portfolio that is really focused around infectious disease. The goal is to expand that portfolio to include many more treatments for chronic disease, which will become much more of an issue in countries as patients live longer and as economic starts to have an impact. So we're looking at new medicines in terms of mental health, cancer, cardiovascular, and asthma. Thirdly, healthcare infrastructure. That talks to the 20% reinvestment I talked about, but also we aspire taking more of a leadership position in healthcare infrastructure, more as a catalyst in terms of new models that can help to supplement and improve capacity in countries where we operate. And that's good for access. It's also good for our business. The better healthcare infrastructure, the better capacity, the more medicines that we can supply. So we do see there's significant shared value in that support of healthcare infrastructure. Fourthly, it's about our people. So we need to be shifting our own unit and our own transition to people supporting our medicines, but ultimately leading to people who are acting in a much each way with the healthcare challenges that exist in each of our countries. So that we want people to be able to approach dialogue with government, with NGOs, with the private sector. And rather than saying, well, these are the medicines we have, we want to say, you know, what are your healthcare challenges? Where are you trying to get to in the next 5 years? And how can GSK help? How can a company be a part of that and a partnership? So on that note, I will finish off and hand back to Carl.
Thank you so much. That was fantastic, and I'm sure we'll have some questions coming in for you. Next, we'd like to hear from Ole Kiergaard Nielsen, who is the Program Director of Corporate Sustainability for Novo Nordisk. Ole, over to you.
Thank you very much. Next slide, please. I'm very happy that you have the interest in calling in and listening to this shared value seminar. I'm going to talk to you about how we our business in China and why. I think most of you would know that China is one of the growing economies, and with that comes unfortunately also problems such as diabetes. We will be right now, and this is looking at a number of some 92 million diabetics in China, and that we are foreseeing that number will be growing due to aging population, but also due to urbanization and other factors such as lifestyle and these are factors we see all over the world, and that what we see is this non-communicable challenge disease is hugely for healthcare system, because they will have large that cannot be the moment be dealt with. What we see is that there are some 70% of diabetics in China that are not diagnosed, and 1 out of 10 of these diagnosed people are actually managing their condition to basically achieving targets. It means that we are facing huge problems with people with diabetes in China. We see low levels of physician awareness and training of patients is a challenge. What we do see is, for instance, that a patient would have a minute with their physicians when diagnosed and when discussing diabetes, and this is, and when knowing what diabetes is a life condition that you really need to, and therefore new ways needs to happen, new things needs to happen. And what we are trying to do is go out and measure how can we do a difference for the barrier? And if you go to the next slide, then our approach is to, instead of competing for these very few that are currently being treated and diagnosed, we think this is really not helping the situation in China. This is zero-sum thinking. We think we can grow the market. Can we somehow expand the access to the underserviced 87% of the people with diabetes, or people that are not at least being diagnosed or treated, and this is basically a focus we've had. We went into China some in 1994 and have had a huge success in China. But we did that basically with a shared value thinking. But at that time, we didn't know that there was that it should be called shared value. I think at that time we went into China and said, how can we actually make a strategy that will be mutually enforcing the Chinese society and our society? And one of the first things we did was to make a huge partnership with the Ministry of Health to develop national guidelines, because there was basically very little awareness of the problem in China. So if you go to the next slide, we basically went in and said, okay, if we're going to work with the society, how is it that we can work on the different levels that really needs to be dealt with in a country where diabetes is developing to these catastrophic levels? And first of all, what we do, we work on how can we actually work prevention, and this is, for instance, through the public-private partnership with the Ministry of Health. We've said, okay, how can we work with early diagnosis? And what we do, for instance, taking diabetes bus around in the country and are putting sort of actions down to the insufficient screening, and also making public awareness about that disease as a problem. And to improve the quality of care, because we are really seeing that the insufficient diabetes or ability to pay for treatment is a problem, because patients may not have this access to patients or to physicians, and therefore we're working very much with healthcare physician strengthening, and we have, for instance, trained some 50,000 physicians in how to deal with diabetes. The next steps that we are looking at is how can we relation to the opportunities. Right now, if you look at it, all pharmaceutical companies have been focusing on what will be the largest cities in China, and this is getting quite well covered. But when you look at that population, is actually only capturing some 230 million people, and that still leaves 1 billion people with low or access to healthcare services, and that's one of the things. And to sort of also learn more about how are we then how are the things that we do. We actually do training of physicians in these areas. We've also gone out and said, okay, how is that by the physicians and we've sort of asked them, and when they come back, we were surprised to hear that physicians in rural areas or in tier 2 cities, they were more they got better results of our training than the physicians in tier 1 cities. And basically what we sort of concluded based on that was that the physicians in tier 2 cities or tier 3 cities, they were not seeing so many different pharma reps. And in this context, I think it's important to emphasize that a lot of the education that is given and these physicians will get is actually coming from the pharmaceutical industry. There's very little training, very little sort of education, re-education built into the Chinese, especially on diabetes as a disease. To conclude, what we are going to do and what we are actually doing right now in a program called the Blueprint Program, we are tracking our progress, the programs that we are running in, not only in China, and in a lot of countries to optimize the program for best results. So over to you, Kyle, again. Thanks.
Thank you so much. Now we'll hear from Kathy Pickus, who's the Vice President of Global Citizenship and Policy at Abbott. Kathy, over to you.
Kyle, thank you very much for that introduction, and thanks to the entire FSG team for organizing us today. So at Prepare, I looked back at a recent review interview with Professor Michael Porter on the topic of creating shared value. And while he said many things worth repeating today, in the time, I'll focus on just one thing in particular. Professor Porter said that historically, it was considered that what was good for business was good for society. And today, actually, the opposite is true, that what is good for society is good for business. And that statement, as we enter markets like where there is both just a tremendous business opportunity, but at the same time, complex societal issues that have to be addressed in order for business to be successful and for us to deliver exactly what to the patients. Okay. Now, digging in a little bit deeper for some context on India, here's a bit of background. As stated on this slide, has many challenges, as most of you know. People lack access to affordable medicines. There's a great market for counterfeit medicines, and the country lacks both, infrastructure and the necessary public in the area of health. And there's a tremendous, disease. So as set out to do business in India, we were mindful of these challenges, but eager to leverage some strengths as well. First, we had unique resources, partnerships externally. Now, first on the internal part, Abbott has been operating at a respectable level of investment in India for decades. But it was 2 years ago when it acquired Piramal, a local Indian pharmaceutical company, which made Abbott one of the largest pharma companies in India. Everything changed. Now, expectations, our ability to deliver a wide variety of medicines, employer engagement, wide variety of things. But much to my delight, and as we about Piramal, what we found is that Piramal had created a social business unit called TrueCare. Now, the goal of this is to provide medicines, branded generics to a segment of society that to date had not accessed medicines as it needed. Its motto is simply put, to democratize healthcare to India. Strength was in the model that trained and educated local citizens from these aspects of the market that we hadn't been able to reach, and that not just with access to inexpensive medicines, but also robust healthcare information. And thinking also about the model from the unit, they're selling small quantities, sometimes 1 or 2 pills at a time, equal to about 2 cents in terms of what was being as in terms of revenue in these communities. So significant challenges on that front, but it was a very interesting model and something that we could leverage as we were starting to think holistically about Abbott's presence in India. Now, the second strength that I just mentioned was our partnerships. This brings us to those external partnerships that we had, and one in particular was with the leading NGO CARE, led by Helene Gayle. And I might add that while the business model is changing for all of us, the business models for NGOs are changing dramatically as well. And I have to salute Helene Gayle and her vision. Recently she announced the creation of CARE Enterprises. So here's a traditional NGO that has been operating in a traditional way, accepting grants from organizations, individuals, foundations, taking those financial resources, and then putting forth a strategy. What she has done here has really indicated that there is a strong shift in terms of how they operate, in terms of what their expectations are and what their strengths and beneficiaries. No longer do they want to have their beneficiaries sit on the sidelines of the globally. Moreover, they want to give them the tools and the partnerships, them engage as active members of the economy for the long-term success of these beneficiaries. So the work with Abbott and what we have embarked upon with CARE is really leveraging our lessons learned around PeerMo and our trust and outcomes that we've achieved through our traditional partnerships with CARE. But what we're doing now is finding ways in India by which we can partner with CARE in terms of helping us do two things. Help us reach those aspects of society that haven't had access to medicines that they so uniquely and critically need. And secondly, we want to also ensure that the partnership is sustained for the long term, that we have a financial and business relationship with an NGO that will take both organizations well into the future to achieve these mutual goals. But I have to say, this is not an easy shift for either organization. And I embark upon these partnerships with NGOs in a business-like sense and creating shared type of. It's important that we stay the course and be patient. It's going to take some time because I think both organizations have to address their processes, their skills, how they're organized to ensure that some changes are made so that there is more integration. The partnerships are very transactional. We've given grants to the organizations, they go off do their thing. Now we're business partners, and I think that the opportunity for success is there, but it is going to ensure that we take those necessary steps to create a business partnership where there previously was not one. But overall, we're excited about what will result for the long-term infrastructure for the patients in India and elsewhere, and think it's a great model for us to keep you all informed on as we move forward. Back to you.
Kathy, thank you. That's a great to our last who is Carl Pittman, the president and CEO, and he's going to talk about new forms of partnership from the NGO perspective. Carl.
Thanks very much, Kyle, and hello to everybody on the indeed, listening to Kathy's presentation and just sort of nodding my head as we at PSI, a nonprofit social company, look at the partnerships and the challenges that they represent, but also the opportunities they represent. About 3 examples that we've got. 2 of them are pharma, but one, as you'll see here on this first slide, is a fast-moving consumer goods company. So we're working with Unilever to promote water and sanitation projects in a number of different countries, and specifically in Kenya, Zimbabwe, to promote washing, using some of the brands, well, a particular brand of Unilever, but also focusing on the behavior and trying to get the behavior mainstream through school-focused programs. Also working on household water treatment solution in other parts of the world with Unilever. What's the attraction for us? Well, Unilever, a world-leading fast-moving consumer goods company that has a lot of experience with, I would say, middle of the pyramid and increasingly bottom of the pyramid marketing. We are a social marketing company with a social mission, using marketing tools to focus on that same segment. Only their business and our business aligns, overlap. We think we can learn from each other. In this particular case, Unilever, the partnership with Unilever, modeling, use disability adjusted peers as a measure our outcome. That's our retained earnings metric, if you will. And every intervention that we have has a DALY associated with it so that we can track our cost effectiveness. Well, by partnering believer on hand washing. We're able to develop the modeling that interventions. And we know there are going to be very cost-effective interventions to address the underfunded and underaddressed in most 60+ countries where we work around the world. Next slide, please. So I said there are two pharma examples I'm going to list. Novartis is one. We have a big relationship with Novartis in terms of anti-malarial, artemisinin and combined therapy. That's the medication used for treatment of diarrhea. In Malawi, Novartis was looking to expand their reach into the because there were a number of challenges and problems with the public sector, number of stockouts, and the premium private sector whom Novartis was traditionally working had a very limited reach. We, on the other hand, have a lot of experience in Malawi and with what would be termed the non-premium private sector. So a part of the market that is with a lower price point, typically aimed at consumers lower down on the socioeconomic chain. But still, the private sector, typically in Malawi, as in many parts of the developing world, is reaching many more of these, or is the only access that many of these people have to healthcare products and services. The sector is weak. So here we have an agreement for preferential pricing and using some branding that we are developing with them to distribute recovery basis combined therapy through the non-premium private sector. In this partnership, Malawi's gone through a difficult political transition recently and a big devaluation. These are big disruptive efforts or actions within our market, but nonetheless, we take of this go much faster than we prospects see. We wanted to generalize this to other countries. We have a lot of treatment and programs around the world. I ran into some roadblocks, and I think Kathy was alluding to that as some of the challenges as nonprofits and for-profits explore this shared value space. And we could probably have a whole other webinar on those challenges, but just to put that on the table, there are difficulties as we try and find win-win solutions for both. Next slide. Finally, Merck, as another example, Merck has a Merck for Mothers commitment that probably many of you know about. It's very substantial, $500 million commitment that Merck has made, working with enough governments in the developing world for safe motherhood. And, we're delighted to be working with Merck to expand our social franchising in Uganda, again, to providers to reach women and mothers with their services. But specifically in this partnership, Merck has lent us a number of their ninja marketers. These are marketing professionals from within Merck who are detailed to PSI to help us with execution of our marketing strategies and to improve our ability to deliver to the consumers, the $1 and $2 a day consumers who are our target audience. So we have them for a number of months. They're helping us with our strategies in Uganda, in Myanmar, elsewhere around the world where we have social franchising programs. They learn about our distribution and marketing system, about line marketing execution skills from one of the leading pharmaceuticals. Final slide for me, next please. So just to go back to the principles that the important FSG paper identified, success factors in shared value. In the examples that I've talked about, we have, particularly with Merck, focus on determined leadership at the corporate CEO level as country levels for us. With Novartis and Merck, we have a desire for mutual learning and shared innovation in terms of modeling, in terms of new channels of distribution. For Unilever, we see examples of new approaches. I mentioned the help that we're going to get from them to develop our DALI modeling more extensively. And the partnerships just in general for us are a way to really creative ways to deliver value to our consumers and ultimately to our public funders who are and what we can provide as the tools of social marketing to reach poor and vulnerable consumers. So from our perspective, the shared value space is exciting. We learn a lot from it, and we look forward to more partnerships as we try and grow our impact around the world.
Carl, so I've been monitoring the questions that you all have been sending. We've received about the pluck among all these gems that we found here. And since we've been talking partners over the last 15 minutes or so, why don't I direct this first question to Ole, Duncan, and Kathy about partners. How has shared value thinking changed how you approach discussion and partnership with global stakeholders? Why don't we hear from Ole first, Kathy, and then Duncan.
Okay, let me be brief. I think for us, it's transparency. Definitely, when we go out and talk to our partners and global stakeholders, then when we talk shared value with them, they're feeling okay. You're putting everything on the table here. Before, when we were talking CSR, or what we denote as the triple bottom line, never really indicating what was our upside of this relationship, then people were always looking at an upside, thinking some agendas, or what is their agenda, or they're just into sales. And yes, we are earning money on selling drugs, and this is a fair. And what the shared value is giving us, a real tangible way of talking about the fact that we are, as a company, trying to, of course, do something very good for society, but at the same time optimize our own sales creation. And I think for us, this has been definitely the strongest part. And then the past message, it is also giving us some guidance on how can we maximize what are the activities that are providing better value for society and for us, and how can we integrate that into our leadership decisions going forward as well. So that's a more internal focus as well. But for the shareholder, back to the global health stakeholders, that's really transparency is really the one of the key outcomes.
Great. Kathy?
And I'll tell you, I have to say that our shared value with stakeholders have been very positive. The reaction has been very positive because I think what the expectations are greater than what they've received with regard to traditional philanthropic programs. I think that what they see now is that we're getting access in a more long-term way. I think we're getting great positive feedback from that.
And Duncan?
Yeah, I'd really agree with Ole on the openness and transparency. Certainly from the company side, being very clear what we're getting from it, charge, what profit we're going to make, being very open about that. And I think that's not the history of the industry. So it's just sort of signifying a bit of a change there, I think is important. And secondly, being more open and probably a little bit breadth about what we're expecting from the partner. So in terms of incentives, energy and motivation, and what kind of system is behind that, and being clear about that. Secondly, I think trying to bring faster decision making, clearer accountability to things, and I think hard enough to get things done in developing countries, as we all know. And what we've got to try and do is, at the company NGO level, be quick as we and just get on with stuff. And then thirdly, I think it's actually choosing the right partner that responds in the right way to those things, so that is also open and transparent, and kind of gets it from the company's perspective as well as from mission the NGO is got clear accountability and is, can do quick.
Right. Duncan, thank you. So, Carl, a follow-up of partnerships. We have a few people who have picked this theme from KC about how NGOs are also changing their business model, which is pretty provocative. So, in your mind, should NGOs be more proactive in sort of naming their offerings, pushing themselves to companies? It seems that a lot of effort by reaching out to companies maybe is not so clear on shared value.
I think, as both Kathy and you have put it, there's a traditional model of interaction between corporate and NGOs, and it's been focused around CSR and transactional relationships. All I can say is we see that as the past. I can't speak for everybody in the NGO sector, but these institutions and NGOs in different ways are engines of, and the sooner we can figure out how to make business practices, I would much prefer to be dealing with a corporation in a sense than in a CS. I think we need to move the relationship between corporations and NGOs out, increasingly out of SR context and into the P&L context, because that's really how you build sustainability. But it's not always going to work. There are competing and conflicting views and motives, but there's more alignment than we often assume, I think, and we should explore that actively.
Thanks. Moving from of stakeholders to shareholders, we had a couple questions come through investors. So for Duncan, let's start with Duncan, and then move to Kathy, and then Ole. Here's a question which may be a little tough, which is, what have been the reactions from investors regarding shared value and your effort behind them?
So it's very. I think probably the first answer to the question is that this approach might be material to the company, so it's unlikely to influence an investor decision whether to buy or sell or whatever in a company's shares. Having said all that, investors are very interested in how companies are evolving and strategy from that perspective. My experience presented the GSK model to investors, and they kind of fall into two camps. One camp is incremental business that the company wouldn't necessarily get, and they're profitable, and that's good to have. So that's good as an. They all recognise the importance of making a difference on the CR element to what we're doing, the whole kind of license, and that is investing for the future in terms of your in society and world. The other camp, frankly, are worried about dilution. They're worried about my unit, for example. We operate margin, which is an Indian, for example. In the emerging markets, we're 35%. So they kind of are just worried about the dilution. For me, investors are always going to have different. I think what's important is, this is what we're doing. We believe in it, and investors therefore have to see you either way, whether it's something that they like or they don't like.
And to just build on what Duncan, it's Kathy and I agree. I think one of the things investors are keeping a sharp eye on is the strategy in the markets. They understand that they're complex marketplaces with all kinds of challenges, and I think they're looking at business, how they sustain their operations and a model that's successful in the West into these markets. And these innovations, I think, will pay
and I think what the investor instead of saying that then we know very directly because we did these shared value cases, a blueprint China and one on US, and now they have actually been presented 2 years in a row for our investors, I would very much agree. Can divide the investors into two categories. There would be the investors that would get profit and loss and what is actually developing development lines and all that, and well, how does our look like and what's the probability of success. Factors are still the most important parts on companies such as at least. Sort of building for the future. That's where investors are interested. When they hear that some 50% of people with diabetes are coming from developing countries, then they would say, okay, it's likely that it's interesting what you do, and therefore we will monitor very these results that you come up with, and this is also giving us a broader understanding on how you are creating value and are preparing for the future. So that would be the other end of investors as well. I would say having this more broader value view.
Great, thank you, Ole. Time for just one last question. We have this is for all, and if we could just 2 or 3 sentences because we are limited to time. Question came through that asks, for young professionals who are very intrigued with their value, what type of backgrounds and competencies are you looking for to hire? Why don't we start with Carl?
You know, we draw from all sorts of different backgrounds with development and profit, so as you would expect, we get a lot of people who come with a background, for example, in the Peace. But some of the most successful people in my private sector backgrounds, marketers, Coca-Cola, General Foods, General Mills, have a sort of an expectation of people going back and forth from our world into the for-profit world. For example, we're losing a key employee to Merck in the near future. Business backgrounds are crucial to achieving our social marketing mission, and anybody who's interested in this intersection of and social responsibility, I hope you look us up.
Great. Duncan and Kathy, and if you could please just
So I look for general on infrastructure in our unit, so people have got to be able to do different things. We've also got to be good at looking for opportunities, a little bit entrepreneurial, form connections and engage relationships. Thirdly, a medical background, very helpful. It helps to build credibility. You've got to really understand from. And fourthly, you've got to care. You've got to care about access. You can't just be focused on business. You've got to have a mindset that cares about patients, about access.
thanks. Ole?
I would say very much like Duncan, we are looking at care with a passion, and then of course, they need to have some sort of background that having a foot in each camp. So you need to have some at least business acumen, and you have some social acumen as well, and you need to combine and understand and talk the language of both sectors. But when that is said, I would say passion is really the overriding factor when we hire.
Kat?
Very quickly, policy background, has spent some time with an NGO, go get your MBA, live in India or China for a while, develop some language skills, and don't be afraid to take.
What a great way to end it. Listen, everyone, thank you so much for attending. I'd like to thank our one panelists, great contributions today. We would also like to thank our partner, GBC who helped to make
Yeah.
this webinar possible.
Makes me wonder, do we
So let's
have
recording of
developing nations?
along with the slides that we use today will
We
be
do in
available
emerging markets,
to
we
set
do.
up on our
But we don't, I don't know that we have a specific focus on
FSG.org.
50 least.
And please help
Yeah.
improve
Well, it's
the
everything.
quality of our
I mean, it's
webinars
those
by
three
filling out a
groups.
brief
Do they have
survey
a
that will pop
big
up
focus on
to the
big
webinar,
salaries
which will
and
end
the per
about 10
TNK?
seconds.
Yeah.
So thank you all very much,
I think they're a little
and please
less
keep
focused
on
on
FSG. We'll be having other webinars.
But I don't
this year.
think that we have
Take
such
care.
a clear strategy the way they
that's
do.
very
What
That
is
is
FSG? Do you
phenomenal.
know what FSG is?
I was just trying to look it up.
I hate these acronyms. Like, just tell me what you are.
So they hired, we hired external, we
Consulting.
hired PSI to do
Yes.
Mothers for Merck. I didn't know.
I know, it's very
Wow.
cool.
Wow.
We're really
FSG
lucky to have
Social
someone like
Impact
that.
Wow,
Advisors.
that's awesome.
Nonprofit consulting firm specializing in strategy,
So
evaluation, and
she's gonna
research.
report to
That is so
Nadine.
fun. So
Naveen
did
Rao.
you just learn
We
this
just
from
We
found
just
out
learned it.
before you walked in.
Yeah.
That is so
What?
funny. I mean, I just heard that she was leaving, but I didn't know where she was going.
We
Oh,
are.
yeah, sorry.
Yes.
Okay, yeah.
Yeah, or whatever they're called.
I have somebody right after
Wow.
you.
Okay.
Up there if you want to.
That's interesting stuff, isn't it?
Yes.
I'll
Yeah.
catch you before you-
This was so
Cool stuff.
worthwhile, thanks for.
Yeah,
being here.
no, I'm glad that you guys
You
came.
can leave that on.
New career,
It's good to come
Opportunity.
upstairs.
isn't
Okay,
it?
that's fine. You can log off.
We used to work down
Like-
on the 4th floor.
There's natural light.
Our department was located down there, and it was really
The cave.
depressing. Yeah, we
Yeah.
called it the cave.
Yeah.
I did anyway. I never got to see people.
You're on video. Ah. And